Good morning, good afternoon, and good evening, everyone, from wherever you may be joining us in the world today. My name is Francesco Del Carpio, and I'm the CIFAL York Operations Coordinator. I would like to officially open the second session of the Climate Change and Global Occupational Health and Safety Speaker Series in partnership with the Restore Lab at the University of Toronto, the Datalay Institute for Global Health Research, and the Global Labor Research Center with their land acknowledgement. We acknowledge and recognize that many Indigenous nations have longstanding relationships with the territory upon which our campuses are located that precede the establishment of York University. The area is known as Tkaronto and has been caretaken by the Anishinaabeg Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nation, and the territory is subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. As this is an online event and our participants may be joining from various locations, I strongly encourage you to learn about the traditional land upon which you are located. With this, I welcome our moderator, our speaker, and our participants from around the world. Welcome to our webinar. Without further ado, it is my great pleasure to introduce our moderator, Sonia Sanita. Sonia Sanita is a healthy built environment specialist with York Region Public Health. With training and experience in planning, public health, environmental studies, and education, Sonia is a public health practitioner and collaborating with regional and municipal partners, as well as other stakeholders to create safer, healthy, and complete communities. Sonia is also partnering with academia to develop educational opportunities for training and health and development. Sonia, the floor is yours, and thank you very much again for moderating today's session.
Thank you very much. Hello and welcome, everyone. I'm Sonia Sanita. Thank you, Francesco, for the introduction, and thanks to everyone for attending this session 2 on climate change and global occupational health and safety. I encourage everyone to attend upcoming sessions as well across the next few months. And just to note that participants who attend 50% of the sessions will receive a certificate of attendance from CIFAL York. And for this webinar, feel free to ask questions using the Q&A button below. We will address questions following the presentation. Also, feel free to share links or any other information in the chat function. It is with great pleasure to welcome and introduce our esteemed speaker, Dr. Vijay Kumar Chattu, a global health physician specialized in global health governance, global health diplomacy, and global health security. Dr. Chattu did his MBBS and MD in community medicine from MGIMS, Sewagram, and PH in health policy and management from Belgium, MPhil in global health governance from South Africa, and his PhD thesis in international relation focuses on global health security and global health diplomacy. He did a specialization certificate in global health diplomacy from the Graduate Institute of Geneva and a diploma in global health diplomacy from Nova University in Lisbon. Dr. Chattu recently completed a 2-year fellowship in occupational medicine at University of Toronto and is identified as one of the researchers in sustainability at the University of Toronto, considering his exceptional work. He has an excellent track record of over 300 research publications and has been ranked consistently among the world's top 2 scientists in public health by Stanford University rankings in both 2022 and 2021. As a global health policy advisor, he contributes to the T20 policy briefs for the G20 summits and also provides consultations to multilaterals such as World Bank, UNAIDS TSF, and the World Health Organization. Dr. Chattu also serves as a governance co-lead for the Climate Health Network hosted by United Nations University, CRIS, Belgium, and Ghent University. His interdisciplinary research in medicine, health, economics, and social sciences focuses on strengthening human security and development. And I will pass the floor over to you, Dr. Chattu, and look forward to the presentation.
Thank you very much, Sonia, for this wonderful introduction. And good afternoon, good evening, everyone. And I'm really honored to be on this platform. And I especially thank the CIFAL organizing committee, especially Dr. Ali and Francisco, everyone who is involved in this organizing this wonderful event. So without wasting time, I would like to share my screen. Yeah. So the topic for my today's talk is global health governance for climate-induced global occupational health challenges. So I would like to disclose the financial commitments or obligations or sponsors in whatever. In that case, I have these grants which are from the federal government of Canada and also as a co-PI and also from government of India. I also want to disclose the honoraria which I received from various universities globally, and also the consultation fee, which I've been working for my professional consulting services, and the royalties from the publishers. And yeah, you can see my affiliation, other affiliations. So I hereby declare that there are no potential conflicts of interest, and the views and opinions expressed here are my personal and do not necessarily reflect the views of the organizations I'm affiliated with. In regard to the mitigating the potential bias, the information that I'm sharing with you is evidence-based. I want to emphasize that. And these are documents from the United Nations or WHO or other acceptable formats. And besides the program, the material that is peer-reviewed and also the recommendation, especially in clinical medicine, in terms of the evidence used in the climate change impacts, they are all actually peer-reviewed scientific literature. So coming to the objectives, today in this presentation, I would like to highlight three main objectives. One is to highlight the various climate-induced global occupational health challenges. Then secondly, to familiarize the concepts of both global governance and global health governance and various global goals that are relevant to climate change. So this way we try to connect the governance in relation to the climate challenges. And finally, we'll see the role of global health governance to these climate-induced occupational health challenges. So as we all know, in the previous seminar, we have seen the burden of global occupational health, occupational impact, basically how occupational health is impacted by the climate change. This presentation will not be in-depth looking into the clinical features and the disorders, but it highlights mostly at the global perspective, what is the burden, or what are the major impacts at macro level. So it is estimated that between 2030 and 2050, approximately 250,000 deaths will be happening on a yearly basis because of the impact of climate change, either because of malnutrition, malaria, diarrhea, or heat stress, the others. And in terms of the economic impact, the direct cost to health is estimated to be between 2 to 4 billion per year by 2030, which is a very huge burden, which can be actually prevented if we can take appropriate measures. And the impacts of climate change on health, actually they affect nearly all sustainable development goals in some way, either directly or indirectly. So these things, we will see more in depth as we go through. So coming to the first objective, here, we will see, we will highlight what are the main challenges that are induced by the climate change. So in this slide, you can see basically an overview of the impacts of climate change, what are the vulnerability factors, what are the different pathways, and how it is impacting the health system. So this is a generic slide, which in general addresses the climatic impacts on either occupation specific or in general. So you can see there are different kinds of health risks involved, such as injury and mortality because of extreme weather events, health-related illnesses, respiratory illness, waterborne diseases, zoonosis, vector-borne diseases, malnutrition. And of course, it also has an impact on the NCDs and mental health and psychosocial health. I think, these impacts were discussed in detail by Dr. Baidin in his last seminar. So this is an overview of the climatic hazards that happened actually since the last 60 years. So if you see from 1960s, we see a trend of increasing in number of these events. Either it is storm or floods or extreme temperature or drought or wildfire. So basically, we can see every decade, because of the rise of temperature, you can see the impact that is happening on the human health as well as on the infrastructure and in general the planet. To summarize, you can see this is a table where you can see the different health impacts. But as you can see, these are not actually very focused to the occupational health. These are the climate sensitive health risk in general. So this gives an overview of again, what are the different conditions or diseases that can be spread, or that gives that becomes more vulnerable during the because of this climatic changes. So we can see the wide range of diseases as discussed before, but I think it's good instead of spending more time here, I would like to go to the next slide where we will address more about the occupational health impacts. So this is our conceptual framework, which shows the relationship between climate change and occupational health. So this is very important in the sense, the seminar is basically the focus is to address how climate change affects the occupational health settings. So, if we can see the different contexts, we can see that temperature, for example, the ambient temperature, increase in hot days will result in heat stress, increase in air pollution. Again, your airborne particles will be increased, and that will result in cardiovascular respiratory diseases. So as we can see, the impact of different environmental changes on this left side and how it is resulting into the occupational health effects. So these frameworks have identified it. It is adapted from Schultz and Chun. This is a report actually published in Montreal a few years ago. And this framework is even relevant now, and it is very applicable. So if you see the changes in the industrial and built environments, that's the reason why we are advocating for change in structure, improving the sustainability and climate friendly, because if these industries are not addressing these effective models or smart designs, then again, it will result in different physical conditions as well as mental stress and, psychological impacts and other different diseases. So what are the occupations that will be impacted? So, here, I have listed the occupations that are mostly outdoor and some are indoor. So the major occupations that are outdoor are, as you all know, construction, agriculture, and tourism. Then you have the emergency response and recovery workers, then the fishing industries, the forestry and utilities, dairy and transport sectors. So these are the sectors where the workers are mostly outdoor and they are exposed to these extreme climatic conditions. And it is not that people who are working indoor are always safe or, they are not exposed. If you look at these industries, such as where you don't have the air conditioning inside, for example, the bakeries, warehouses, and foundries, where that molten lava or, molten metal basically is used, and they are using that molten things to prepare various instruments. I think, again, as you see in the picture, people are working at a very high temperatures there, and, this is actually going to have heat exhaustion to, make it more severe conditions. So again, this is from the schools and the team, they have developed this conceptual framework. Sorry for the poor quality of this picture, but I think, what we have to, what I'm trying to emphasize here is that impact of climate change is actually at 3 different levels. One is the individual level, the second one is the natural resources, and the third one is a socioeconomic context. And each level, if you see, there are different kinds of exposures and hazards. And again, they are impacting. If you look at the second circle in between, you can see the effects on workers' health and safety. So I think, our lecture or our seminar today will be focusing on the impacts on workers' health and safety. So here we can see how, for example, you can have muscle cramps, fatigueness, or, mental disorders, or you can have other job insecurities, eye diseases, all these things are listed here. So I have summarized here basically what are the different occupations and what are the common diseases or ailments or conditions that are because of this extreme climate or weather changes. So you can be, the workers can be affected by the chronic dehydration. They can be affected by the injuries. They can be other heat-related illnesses as they are working outside, outdoor, as we discussed, and Lyme's disease. And in the agriculture sector, people are trying to adjust to the various climates, and according to the climate, again, you are also there is also the pest development, and for that again you have to spray all the pesticides and all that. So basically it is a chain event. Basically it is the events, to stop one you add something, and again you are accumulating those risk factors in. So coming to this slide, what are other changes apart from these challenges what they face directly? The workers also face other challenges such as power outages that shut down their home, air conditioners. When they come back home again, because of these other factors, they don't get proper rest and they are exhausted, they are dehydrated, and there's so much stress. So these are the other things that are actually adding in a cumulative way. Then again, especially for the people working in low and middle income countries, the challenge, there are other extra challenges because of malnutrition due to food insecurity, distress due to forced displacement, and collective violence due to socioeconomic or political instability. I think this is the socio-political and socioeconomic perspective, which is often ignored when we are designing policies. And that's the reason why we are talking about the governance and why we are linking that global governance with that climate change in the occupational settings. So the Intergovernmental Panel on Climate Change in 2014 stated that the differences in vulnerability and exposure arise from non-climatic factors and from multi-dimensional inequalities. So it's not just the climate, the heat that is actually affecting. It's because of other factors as well, and also coming from different dimensions, including a lot of inequalities. So these differences shape differential risk from climate change. So basically, people who are socially, economically, culturally, politically, institutionally, and otherwise marginalized are especially vulnerable to climate change. So again, it brings to a point that, it is not that the direct effects of climate change, but your vulnerabilities. If there is existing inequities, basically, I think, they are going to actually increase these impacts. And that's the reason why we need effective governance mechanism and all. So this comes to our second objective, to talk about or to learn more about global governance or global health governance, which are applicable in climate change. So, I will discuss briefly about this global governance because according to the Commission on Global Governance, as the name suggests, it is the sum of all the myriad ways in which individuals and institutions, both public and private, manage their shared affairs. So in a way, it is not in isolation, it is a collective form of governance, global governance, as the name suggests. So it is a collective form. But because of this globalization, actually this made it more complex because, you have a lot of players coming into this arena. You have the private, you have the civil society, you have the government, what we call a state. So you need a model, that actually incorporates everyone because, you need to hear everyone's voice in this. Because most of the times, when we look at these climatic events, you don't see the governments actually coming forward. You see the civil society coming forward to fight for the climate or to fight for good quality air or whatever. So, in a way, the governance must be a holistic. So, for this particular thing, I think, I prefer to use, in my research I use the summative global governance, which actually, summarizes, which actually incorporates all these kinds of governance mechanisms, including all the stakeholders. So basically, summative global governance is a response to globalizing dynamics because you have the players every time, the stakeholders adding and going off, or, with different hierarchy levels, or sometimes, they don't have any hierarchy. So again, it is basically, it includes the state-centric, multi-centric institutions. So you have the governments, you have the multilateral institutions, you have the bilateral institutions. And also, again, these are at different levels, local, global, regional. So, there are different levels, subnational, national. So in a way, you have, again, formal and informal, top-down, bottom-up. So, it is very confusing and very complex. That is the reason why I'm saying, so the global governance is not just simple, like, you have one Ministry of Health or Ministry of Finance where you have the structure. It is very machine network. So I tried to, put all these kind of state and non-state actors in international relations, we use the state for the government and non-state for the private. So, it's kind of a terminology. So as you can see, the core organizations which have the power in terms of dominance or whatever you see, the rich nations, basically the global north, the G7 countries, the G20, and you have the multilateral organizations, the United Nations bodies. If you go slightly outward, you can see again, in green color, the donor organizations, the philanthropies, people who have a bit more of influence again. So as we are going out, the partners or, the stakeholders are spreading where you can include at the outer circle, you'll try to see the people from the grassroots. That's where you get the civil society, you get the social activists, the media, and the citizens in general. So, they will be actually, this all sometimes formal and informal. There is a communication. You have to understand that everywhere there is a bilateral or, one-way communication or two-way communication among all these stakeholders. So that's how, the governance becomes very complicated. Just to give an example, for the climate change, occupational health, and migration health, this nexus, you can see the national governments, the international organizations here, like all the UN bodies, including the ILO. Why I mention ILO is because it's more related to our occupational health. Then you have the WHO, again, related to the health. And you have the other hybrid organizations, philanthropies, and you have professionals, professional associations. You have people who are from foreign policy, politics, environmental specialists, and everyone. So, and you again, there are venues for these kind of interactions. Sometimes the diplomacy doesn't happen just, at the embassies. It can happen at different forums. But again, I have listed the venues here. You can have these discussions or negotiations happening at different venues, like, let's say, the G7, G20 right now, which are happening. And you can also have at individual offices. Now, I will come back from the global governance to global health governance. So basically here we are trying to have a specific focus on health part. We are not talking about global governance in general, which includes economics or, trade and other aspects. Let us come to the health part. So according to the definitions given by various experts, the global health governance emerged around the millennium, beginning of this millennium. And basically it uses the formal and informal institutions, rules and processes by states and INGOs and other actors for a collective action. So basically the purpose is the same like the global governance, but here it is more focused on the health. So you have the health specific organization that will be taking a more prominent role here. So why do we need this global health governance? So I think, again, now we have to understand that because we have inequalities, we have people living in global south who don't have access to services, or who have very poor infrastructure, or who don't have proper guidelines to do, or there's no proper data collection, there's no proper monitoring and evaluation. So there are a lot of problems, sometimes most of the health systems especially are very fragile. If something happens, especially the COVID pandemic, we have seen even the rich nations could not cope up because the infrastructure and also the kind of impact it had was so severe. So that's the reason why we need a mechanism where, through this global health governance, we can actually ensure the global health security. Because, again, when we talk about health governance, the impact is basically you are trying to improve the human security or the health security dimensions. So basically, global health governance is primarily concerned with health-related institutions such as WHO, the Global Fund, UNICEF, ILO, and all that. And basically, they also have the traditional multilateral and bilateral entities, and you also have the new public-private partnerships. Basically, even it is in the Article 2 of WHO's constitution that, to operate as a directing and coordinating authority on international health operations. So the WHO is also entitled, or, it has its own role to take the initiative, to take the lead role to lead such initiatives. Now, I think, we will spend some time for my objective 3, because this is the area where, we need to, the whole seminar is focusing on. Now we have understood what is the role of global governance and global health governance, and how these governance structures are actually applicable for the climate-induced occupational health challenges. So we've seen the climate-induced occupational health challenges. I mean, it can range from, according to different risk factor or different climatic disaster, you have different kinds of scenarios. So here I would like to take you, because we have United Nations Sustainable Development Goals. We commonly call them as SDGs. And according to that, by year 2020, 2030, because before this Sustainable Development Goals, we had Millennium Development Goals. And since we could not achieve those goals, we forwarded our agenda and we said, okay, we let us increase the timeline and have another ambitious set of goals. So according to that, I mean, these goals are actually approved or agreed by all the member states in 2015. And according to that, we have 17 sustainable development goals, and they address different sectors, starting from poverty, health, equity, equality, industrial development. So we will see the others as we are going through the other slides. But what I want to say is that, it emphasizes that we can achieve these sustainable development goals only when we have this partnership, and also the we can say, transdisciplinary or interdisciplinary approach, but, here is more like, intersectoral coordination, because, the linked sectors, because we will see that, as we mentioned initially, health in a form is actually linked to all these SDGs, either directly or indirectly. So that way, it is very critical. They emphasize the role of health. And even if you want to end poverty or any other deprivations, you need to have the strategies that improve health and education, because these are the key two things, that will actually have a wider impact on a sustainable way. Even though the impact is not immediate, it is slow, but then, that is how you actually bring a change, or that is how you make systems sustainable. And they also will thereby, it will reduce the inequalities, and, it will improve the economic development. And finally, all these things, when you have this kind of complete development, then only actually there is a chance for addressing the climate change or coming up with smart strategies. So here, there are some other, the global legal instruments, basically the governance frameworks that are applicable to climate change. I'm not going in detail more about this climate governance framework, because there is one more seminar in May, which actually focused on climate governance. So I'm not going to talk more about this, but I just like to highlight that, in 1992, the United Nations Framework Convention on Climate Change has come into existence, where all the countries have agreed for that, and, it was ratified. Then later, we had Kyoto Protocol, we had the Paris Agreement. And again, Paris Agreement is very important because, it gave us some direction, for all the global community to reduce the temperature, global temperature by 1.5 degrees centigrade. And also to take it highlighted the role of health, actually. And I think, the WHO has taken the lead in that to forward those goals and, try to make some sustainable impact. So basically, here in this global health governance, again, I want to emphasize that, it is not the role of health. It is not just the hospitals or the healthcare workers who are doing this. If you are looking at the macro level, actually, the commitment must come from political leadership. So the leaders must be committed for that. Unless they are committed, they can't accept for any policy. They can't give permission for any funding. So I think, it is very important that, because many countries, the health budget is very small. And I think, the health minister as such, doesn't have that much influence on the other sectors, because, health itself is having very less budget, and, health minister is depending on the finance minister. So I think, unless you have the political leadership or the commitment from the finance minister and everyone, that's when you can get the funding. That's when you can have these sustainable actions into place. So you need collaboration, as I mentioned. It is a collective procedure. I mean, you can't have health in isolation and take decisions. You need collaboration from environmental health, vector control, water, sanitation, health information systems, policy, and finance. So it covers all the major departments, which are linked to the health sector. So again, the Paris Climate Agreement, as I mentioned, it says that each party shall, as appropriate, engage in adaptation planning process and implementation of actions, including the development or enhancement of relevant plans, policies, and contributions. So it clearly tells all the departments or the sectors that are involved to enact their policies, to come up with strategies to address climate change at their levels. But at the same time, it also addresses the not to duplicate these things. So I think, if you have an effective governance system in place, that's when you try to actually, save resources and try to not to duplicate the activities. So now, I will talk about the International Labour Organization, because since it is a focal organization for exclusively for the occupational health, I think, I want to highlight that, on April 28th, we are celebrating the World Day for Safety and Health at Work. And this is a poster, they have released that, and, they address that, it is having a safe work environment is a fundamental right. So I think, we reached to that level, and it's a great advocacy. I think, this is a result of the health diplomacy and the global governance, where, all the stakeholders, whomever I have discussed before, all the stakeholders, especially the private industry and also the government and the state, they took this decision to frame that. For example, the International Labour Conference, in June 2022, they have decided that, I think they have to include this safe and healthy working environment. So through that advocacy, and I think, through that, they came to a process where they have achieved now, in the sense, now we have a day to celebrate the safety and health at work. If anyone get a chance, you can go through this website, because, in ILO, as we see that, and is a screenshot shared here, you see the ILO is also directly working for the Sustainable Development Goals. I think, the global governance, global health governance, again, you can see the impact of how this global health governance institution, we have WHO, we have ILO, but, since it is more of focus, I'm discussing this ILO first. So ILO has taken a lot of initiatives in terms of addressing the Sustainable Development Goals. And further, it emphasizes that occupational health and safety is not just about only one health. It's not about addressing goal of health and say that, okay, we are talking. So it tries to connect different goals and different targets. For example, Sustainable Development Goal target number 3.1 in health addresses that to reduce the number of deaths and illnesses from hazardous chemicals and air, water, and soil pollution and contamination. So that means, even though it is in health, again, the ILO is taking its role wherever it is applicable. The same thing, in goal number 8 for decent work and economic growth, it talks about protecting labor rights and promoting safe and secure working environment. And again, for gender equality in goal number 5, it talks about equal pay for men and women. So, stop the harassment at workplace and all that. So in a way, ILO is also doing its work as a global health organization in this form of governance. Then we see ILO also talking about other sustainable development goals, like goal number 9 for industry, innovation, and infrastructure to develop it, to make it more modern, more sustainable. It talks about transparency and also effective accountability and transparent institutions for goal number 16. You also see different occupational health and safety related standards and codes, which are part of goal number 13, addressing directly for the climate change. We'll talk more about the smart hospitals and all that. I think, they will come, they are actually part of that. Then finally, on goal number 17, it talks about establishing global partnerships. So for example, WHO and ILO are having a lot of joint activities, and we will see the others. For example, I'm going to finish in another 5 minutes. So there is another initiative by Global Health ILO in collaboration with Safety Health for All. There is a Vision Zero Fund, where it aims a world with zero workplace deaths, accidents, and diseases. This goal is very ambitious, but I think, with the support of the G7 and G20, I think, it's part of Safety and Health for All, which is the ILO flagship program. So I think, this is going to be bring some significant policy changes and also, at both private and also in government organizations with a lot of standard protocols and guidelines. Now I'll discuss more about the role of WHO in the global health governance. So as we can see, the Director General has emphasized climate change as a global health priority. So basically, he in his statement for the WHO Executive Board in January 2020 for the report for 150th WHO Executive Board, he talked about the role of climate change and how we have to protect the environment and also deliver the, even he proposed, the WHO proposed some smart hospital models and everything which came into existence with this kind of advocacy. So what is the view of WHO on climate change? I think, it talks about, addressing understand the great linkage between climate change and operations in the health systems across the globe, both in global south and global north, and also better scientific modeling of relationship between climate change and health, especially focusing on communities in global south, because we see a lot of misinformation and disinformation. Some people, they are rejecting, even the world leaders were rejecting, there's nothing like climate change, So I think, this is very important, and WHO's role comes here because, it is a technical body for giving these kind of guidelines and standards. And also that, the Paris Agreement, as I have discussed before, it emphasized that we can save millions of lives due to improvements in air quality, diet, physical activity, among the other benefits. So in that way, we see the role of health, which is very critical. And if you look at this diagram, you can see it is basically a WHO operation framework for building climate resilient systems. So whenever you have any kind of stresses or any climatic risk or, disaster, your health systems are vulnerable. So, you have that kind of, vulnerability, and, the whole systems, what you have can break. But then if you build resilient systems, what will happen is, the vulnerability will decrease and you'll increase the capacity to cope up. Therefore, you can transform, you can recover better, and also the systems can be more sustainable instead of being collapsed. I just want to, through this slide, I just want to, highlight, as we all know, we have the building blocks of health system, like health service delivery, essential medical drugs, medicines and technologies, information systems, workforce, leadership, and governance. So basically, if you have proper these systems in place, if the building blocks are stronger, and if you have, along with that, if you have these sustainable models or in the climate friendly systems in place, then I think, you can actually have the health systems in a more functioning way without being impacted by the climatic impacts. In this diagram, you see all the kinds of different floods or disasters. For example, flood, storm, and sea level rise, and drought conditions, health, heat waves, and wildfires. Everything, again, as a collective, they are impacting on the various kind of diseases or the health outcomes in human health. Basically, it results in cardiovascular diseases, respiratory diseases, undernutrition, and all that. There's a model in the Caribbean, this is part of one of the programs run by Columbia University, and the experts were talking about developing the smart healthcare facilities, where you need to have safe structures which are more resilient to natural and man-made disasters, and you need to have a green environment, in the sense so that they can reduce the impact of climate change. For example, you can use the solar, you can use other green technologies, zero carbon emission technologies, and you have to maintain them so that this ensure the sustainability. So all these things together, three things together, cumulatively will make our healthcare system smarter. So this is the way, this graph, this picture shows how if you want to ensure the climate resilient health, you need to have a continuous monitoring system. You have to assess them. You need to have proper planning. You need to have effective implementation, and you need to have proper financing mechanisms. So if you see this diagram here, you have the climate resilience. If you have these systems in place, it will ensure the environmental sustainability. When you have the environmental sustainability, it will induce or it will add to the climate resilience, and this will be resulting in low sustainable, low carbon. which is actually, a continuous ongoing cycle. In that way, this is a continuous mechanism without having extra impacts or worse situations on health. So there is a alliance association called Alliance for Transformative Action on Climate and Health, which is hosted by WHO. And basically it forms a platform to call about, it brings all the countries and all the stakeholders together. So it's basically bringing for the higher political commitment so that they can take effective actions at global level. The other policy I want to highlight here is WHO's Health in All policies, where it talks about you have include health, consider health in all the activities we are doing so that, we can have more impact which are without any duplication of services. So, this you can read more in detail, but this is one of the effective global governance. You can use it as a policy for global governance. So what are the more challenges for what we have here is basically we have the IMF and the World Bank. Basically, you have people representing from the global north. So in that way, the problem is, many of the problems are not understood by the global, faced by the global south are not understood by them. Again, implementing health in all policies is a big challenge because not everyone thinks that is feasible, or, they don't think it is a priority. Then again, with the current geopolitics and changing world order, I think, this will actually become a big challenge because, global health governance is not a small entity. As we've seen, it is a very complicated entity. So to conclude, I would say that, the clinicians, public health workers, and everyone must be trained to improve their skills, to identify them and, to take appropriate action. We have to prevent the work-related illness and injuries. And also there should be community engagement and participation. That's when actually, we have all these proper policies in place. And we have to eliminate the global inequality by including global south actors actively, because, if you don't include them again, you can't fill the gaps. And that is very important, critical for us to ensure that. So with this, I conclude my presentation, and thank you very much for your attention.
Thank you so much, Dr. Chattu, for presenting so many interesting insights, opportunities, and important research. Thank you also for sharing the relevant resources, events, and linking to the Sustainable Development Goals. Definitely given us all a lot to think about. If there are questions, please feel free to put them into the Q&A, or anything else to share, please put it in the chat. I just wanted to touch on a couple of points that you shared, and if you can expand a little bit on some pieces that were quite interesting to me. So you note global health governance, and specifically, proper data collection in relation to that. And I wanted to ask, from your perspective, what can be done to improve data collection?
I think, in terms of data collection, I think, a lot of actors are there collecting a lot of data. The problem right now is, that's the reason, we see a lot of mushrooming of courses on data science and big data and everything, because now we have the artificial intelligence and technology come into place. And I think, for example, on these climatic impacts, UNDRR, you have other United Nations bodies collecting a lot of information on climate. WHO is collecting information on climate. But the problem, I think, there is no kind of, one unit, or for example, let me put this way. You have IAEA, the International Atomic Agency. That is the only body globally which looks after all atomic related issues. So, but, when it comes to climate change or climate, you don't have anything like that. So you have multiple bodies working together. Everyone has the data, everyone has the funding. So, it becomes so difficult because, you can't have more clarity because, I'm collecting some piece. It's like, everyone is having a part of cake, but no one is having a full cake. So right now, that is the biggest challenge. I mean, this is a question, we always ask ourselves because, you share some information. I feel I have everything, but now, someone is coming, they are also sharing some information. That is also correct. That is also very important. So I think, that kind of coherence or, that synergy is not there among the stakeholders. And, data sharing is very important here. And I think, What I'm proposing in some of my papers, they are in pipeline, but what we propose is to have the common data, which is available. For example, if you go to, let's say, IARC, you have the International Agency on Cancer. If you go to GloboCan, you have all the data for cancer, right? So you can use the data set and you can use it for your country or for your, your state, whatever. For that, I think, you need to have some kind of, that common data from various partners. And I think, it is possible because right now for occupational health, I can say ILO and WHO can work together. They have actually synergized their ICD-11, ICD-10 with that of ILO classification. Actually, I was part of that document, which they released this year, where the ILO classification of diseases, which is aligned with the ICD-10 and 11. So, now you have, the reporting systems are the same because you have a code and you have the data and you have the impact. So that way, you can analyze at all country levels. So yeah, that is my contribution on that.
Thank you. Very well explained and noted. Thank you very much for your response to that inquiry. We do have a question as well in the Q&A from Feme. How can we participate in international research with UN agencies?
Well, UN agencies have different working models, for example, UN also has a partnership with the private agencies. If you go to the UN website, you can see how UN special bodies are engaged. For example, WHO has a forum where it involves civil societies, people from private organizations or, NGOs. They participate as a, side event in the WHO, World Health Association, World Health Assembly meetings, UN Social Security, you have the Social Economic Council meetings. So I think, UN is always very near in that way, it is, it is not just for the diplomats. It is, the forum is open for the public-private partnerships. In fact, it addresses, it always talks about, involving the civil society and the private sector. So it all depends. The question is slightly vague for me because if you are specific with one particular UN organization, probably I can tell how it is and I can share the details. But, definitely as a UN, I think, UN is for everyone. So, it does not stop you basically. If you want to get engaged, you can get engaged as a consultant, as a volunteer, or, as a part of your organizational affiliation with them through some joint program or something. For example, the CIFAL UNITAR itself is a part of that. I think, people can get working together. This exercise itself is one of the activities, how we are getting involved with the UN. We are improving, we are advocating for this. We are raising the awareness on climate change. So I think these are some of the activities.
Wonderful. Thank you for that response. Just to touch a little bit as well on intersectoral coordination. How can we improve this and what mechanisms do we need in place?
That's a very good question. And it's a big challenge globally. Everywhere, all countries have been facing this because a lot of resources are being, what should I say? There's a misuse, at the same time, duplication of services. At the same time, it's like piecemeal. No one is providing. For example, HIV/AIDS is a very good example I can start with. For example, in countries where HIV/AIDS was a problem, I can talk from my experience working with UNAIDS. You have basically 50 or 20 organizations working for one HIV/AIDS. One will work on general population, one will work on, let's say, high-risk groups. Like, again, in high-risk groups, someone will say, I will work only on intravenous drug users. Other will say, I will work only on female sex workers. So I think, some are working for prevention of, among antenatal women and all. So I think, this brought a lot of confusion among the partners. And, we didn't know, who is working, how they are working and all. It becomes so complex. But again, these services are linked with other sectors like, nutrition, mother and women and child development, or transportation, or finances, because they need to get the benefits from the government and all. So I think, when you have such kind of complex in the situation, the field, it is very difficult to ensure intersector coordination or collaboration. But there is if we have, for example, proper political commitment, I think everything starts with the political commitment. if the country's response is like, okay, the leader is committed, he can say, okay, let us take this evidence-based policies. They employ these technical people, who can assist. For example, WHO is always there to give the technical guidance and all. So through that, probably you can link, for example, this particular climate change or health with that of, transportation, with that of other sectors like, vector, for insecticides, or, working with One Health, involving the veterinary health. So I think, there are different domains here. When they have this clarity, like, health is important, it is linked with everyone. These ministers now have to sit together. They have to check out the plans like, okay, I will do this particular action from my level because this is my expertise. Health, okay, health department should say, we will screen them, we'll treat them. Like the finance should say, okay, we'll provide money for that. Like that other sector should come into place. And, there should be a communication between these sectors. It is not, you give a funding and, you meet after 5 years. I think that won't work. What is happening right now is that people, okay, they will say, no, we are cooperating, we gave our fund, or other one will say, we have implemented this. But I don't know whether you did that or not. So because there's no communication totally, there's no regular monitoring and evaluation. If the fund is actually from an external donor, they will still have, like evaluation midterm or after 2 years or final. But most of these government funded, they will do at the end, only one end evaluation will be there. And at that time, they'll realize that, oh, these guys are working with me because, and they didn't know till then because, and they don't realize there is no communication. So I believe, effective communication with these sectors is very important, and also appreciating the contribution of each sector in this is very important. Most of the times, health sector is like a recipient in front of the Ministry of Finance. The Minister of Finance is always like, begging money from the Minister of Finance, Minister of Health. So in that way, the power is also not that much. So, these things have to be corrected. I mean, when you are working for a program, all the sectors should be at equal pace on the same platform. They should be trying to connect, with each other and do their, work basically sincerely. So that's how, you can have the intersectoral coordination and all that.
Thank you so much for that thoughtful response. We do have a couple more items in the Q&A. So just in relation to the first question that was asked regarding international research with UN agencies, so it was noted that the point is that some low-income countries do not have reliable data on environmental related health issues due to climate change, and the activity of UN agencies are limited. So that was just to further expand to that point.
Yeah, I think, basically, we can take, to be frank, any evidence-based action or, any evidence comes from data. And the data is also not just cooked data, we need quality data. So I think, if you are not confident about the data, I think, we should not make any inferences. Or, we can, even if you make any policy development also, that's not going to be used because, the data which we use is not of good quality. So for many developing countries in Global South, the challenge is ensuring good quality data. It may be because of lack of infrastructure or lack of human resources or lack of, that kind of technology to store the data. We still, in this era, there are still some countries who are still using the logbooks and writing manually and all. So I think, it is, and not everyone feels, the importance of this right now because, the moment, you try to share the data, anyway, there are many arguments right now, on sharing data again. But the thing is, unless you share the data, unless you know what is happening in one particular country, you can't have effective policies and you can't ensure global governance. You can't blame global governance because at that time, when there is no evidence, they can't go ahead with any kind of implementation. So I think, for developing countries, that's the reason where many G20 countries right now, they have taken a decision, and also during these summits, during the UN conference and all, they are giving extra support for these developing countries to provide them with the necessary infrastructure to strengthen, especially in the areas of health and related to climate change. For example, Caribbean is a good example. I think, I attended many presentations recently from Columbia University in Paho, where they are talking about that smart healthcare, where, they are building the climate resilient structures, and also, using the eco-friendly or climate-friendly equipment and stuff like the solar-backed equipment. So, these are the certain things, that can be implemented, in the low and developing countries. Yeah.
Thank you. And just one last question from Darren that links a little bit to what you already spoke to. How does the Global South increase its visibility in international organizations?
Right. Hi, Darren. I think, Darren is one of the alumni of UNITAR. He did his master's recently. Thanks for this question, Darren. And I think, basically, as we know, you are a master in diplomacy now, but the thing is, we know that diplomacy happens at different levels, core level and, informal diplomacies. We have different kinds of platforms now. We have, G7, G20, and you have the other platforms like, at the embassy level and, sometimes, on the side events in the summits. So basically, people from Global South, I'm from Global South. I think, people who want to improve their infrastructure or try to help their, their countries develop or take one forward step. I think, they need to, first of all, I think, they need to share these success stories, how you made, what it may be a small impact you have done, but I think, that has to be shared with the scientific community, shared with your policymakers, take it to a level so that, people talk about that. We do wonderful research. We always talk about good things, but, we always share on ResearchGate or on Google Scholar, but, our work never goes to newspapers or, what common person reads, because, we need to change that mindset. We need to come out of that, try to also, this is my perspective. This is not a prescription, but I'm telling our audience should be general public, not always, public health or medical doctors or social scientists. We should go to the public. So we have to convert our research articles, summarize them in a layman terms, probably. And, I think, once we have that awareness, once you create that, the civic society's, voice and strengthen them, automatically we are raising our visibility. And, that's how, the international organizations will realize. For example, Healthy Caribbean Coalition, HCC in Barbados, you must be you must be knowing that, right? The way they did is fantastic. I mean, they brought the WHO, UN and everyone together. Now they're part of NCD Alliance and everything. So I think, that is very critical that, whatever we are doing has to be with a voice. It has to have a significant impact. The research we do should be meaningful, should be shared with everyone. And, that is, I think, that's how we try to do. And from political level, I think, our technocrats or the leaders will take it further at different global or regional level conferences. So that's the way, we can get the influence of international organizations. We can partner with them. And in fact, they will come to us to partner with us because, they are looking for those successful models. They are looking for those people who are actually doing things in the field. That is my addition in that, Darren. Hope, I satisfied with, the reply or not, but, we can talk later, if you have further.
Thank you so much for your response. And thank you, Dr. Chattu, for the presentation and taking the time to be open to all of the questions and your thorough, detailed responses. Thank you for having me moderate. It's been a pleasure. We're just going to wrap up the session. And Francesco, I pass it back to you to close the session.
Hi, thank you very much. Yes, thank you, Dr. Chattu, for that great presentation. And thank you again, Sonia, for moderating the session. And thank you to everybody in attendance today who joined us live. Just as a reminder, if anybody would like to rewatch the presentation or share the presentation with people in their network who aren't able to attend live, the recording will be up in about 1 hour on both the event page and on our YouTube channel. So you can always go back and review it and share it. And just quickly to end, I will be sharing my screen just to show the next session that we have planned in 2 weeks from now. So for Wednesday, May 10th, it will be Dr. Bedin Naruzikia will be presenting his second session of this speaker series, which will be moderated by Dr. Gottfried Boateng. So if you are interested in that, just be sure to save that in your calendar and share that with your network as well if you know anyone else who would be interested in joining. And with that, I will stop sharing my screen. And I think that's everything for today. So thank you again to everybody for being here.
Thank you all. Bye.